Tonight, 10 on Your Side concludes our in-depth look at the opioid crisis with a question people suffering from chronic pain ask themselves every day. What else is out there for me to get relief besides addictive pain relievers?
Investigative reporter Chris Horn has some different and innovative approaches to manage pain and raise awareness of the dangers of opioids.
Tom and Anita, a Virginia Beach man, feels pain just about every day, but he no longer takes opioids. He didn't want to become another statistic of addiction, so he found a better way to manage his pain. With an average of 3 Virginians dying every day from opioid overdose, the need for awareness and alternative remedies is greater than ever.
My history with pain starts around 15 years old.
For Jason Silverstein of Virginia Beach, 30 years of chronic pain started with the high school football injury. Doctors would always call for opioid pain relievers.
Percocet and the Darvocet was prescribed for 10 days and then sometimes 30 days at a time, and that would cause some problems.
He didn't like what the pills were doing to him, making him nauseous, irritable, hard to get along with, but he feared something even worse.
I think the fear for me was becoming a drug addict.
And then his son hurt his knee wrestling for Cox High School. Like father, like son, he too was given opioids.
And that was really what set off an alarm in my head, was that my 16-year-old son was being prescribed Percocet.
So after his most recent surgery, Silverstein decided there had to be a better way to manage his pain.
They're coming in here as an alternative to using pain meds.
Silverstein started physical therapy with Dr. Spencer Muro, a pain specialist with Centera Therapy Hilltop. Previous doctors had told Silverstein he could forget about ever running, doing squats, or lifting anything above his head.
Up until I met Spencer, I wasn't confident at all, and I'm completely confident now that I can do all those motions.
Muro says once patients understand what causes and worsens pain beyond the underlying trauma or injury, they realize opioids aren't the only remedy.
Stress and depression and sleep deprivation, fears and concerns about what does this pain mean, all those things will elevate pain levels.
Muro is a member of the Heroin Working Group of Hampton Roads, created by Attorney General Mark Herring to address the opioid crisis and find alternatives. Another member, Dr. Ben Fickenshire of Chesapeake Regional, says people in pain do have options.
Physical therapy and biofeedback and massage, meditation, all of these things are what we consider alternative medicine.
Fickenshire also recommends non-opioid pain relievers, Tylenol, ibuprofen, naproxen, which he says have little potential for addiction at any age.
A lot of parents are fearful, that their children can become drug addicts, and I think it's more important to talk.
The DEA wants to kickstart that conversation with middle and high schoolers and get them to avoid opioids through a novel approach. Operation Prevention is a STEM-based curriculum to explain what the drugs are doing to their bodies.
We've had quite a lot of success with this in the districts we've rolled it out. The kids really appreciate looking at it from a scientific, educational point of view, not so much as a police officer or someone talking down to them.
The DEA plans to make presentations on Operation Prevention to school districts in Hampton Roads before the upcoming school year. In the meantime, teachers, parents, and students can get a sense of how it works by going to wavy.com. And that's where you'll find a number of other useful resources, as well as my previous segments on the opioid crisis. Chris Horn, 10 on Your Side.